Some of the barriers that contribute to kind of disparate distribution of vaccine include a myriad of things. A lot of the conversation has focused on medical mistrust that is high in communities of color, and for good reason. And a lot of people quote Tuskegee.
In the 1930s, government doctors conducted experiments on black men, leaving them untreated for syphilis until the 1970s, so doctors could monitor how it affected them.
But there are also current things that are happening. The medical bias still exists. There are lots of studies that show black patients' pain is quite often undertreated and not believed. Part of what influences that mistrust have to do with kind of some of the structural barriers that prevent and make it harder to have access. So if, the mass vaccination clinics are not set up in communities of color, if they're not accessible, vaccine registration systems are largely online. We also know that there's a huge digital divide and broadband divide that exists. You have kind of medically under-resourced communities where you just have communities that have fewer hospitals, fewer providers. You have this confluence of factors that make it harder for people in low-income communities, but also people of color, Black Americans, Latinos, people in the Asian American community to access these vaccine distribution points. And so a lot of the conversation has focused on hesitancy, which is an issue, and skepticism, but you just have this kind of compounding of things over time. And there are efforts to begin to reduce some of those structural barriers.
And so the communities of color, it's a mass casualty event. And so we got to figure out how we make sure we get the vaccine to those communities. There has to be some equity in the way this is distributed.
We are very excited to be partnering with federally qualified health centers, also known as community health centers.
Community health centers provide primary care services in underserved areas, reaching almost 30 million.
Particularly when it comes to the community health centers, they are facilities whose mission serves kind of the medically underserved community, but then becomes a supply thing, Right now, there are over 1,300 community health centers, and I think as it begins rollout, there's going to be one community health center in each state, expanding up to 250. And this initial phase of rollout that's, supposed to begin right after Valentine's Day, that's not a lot of capacity.
Equity is our North Star here.
Like the White House officials have said, equity is the North Star when it comes to the coronavirus response. That then influences states. And it's a mandate when it comes to voters, voters, particularly African-American voters, Native American communities are really kind of bearing the brunt of this pandemic. My mission, and I think a lot of health reporters' missions, are going to be, number one, accountability. As you say, equity is the North Star, and as these are pronouncements that are made, and like I said, initial phases are done, 6 months from now, is the proof going to be in the pudding?